Alrighty, so the last video that I recorded, the child that we used was between newborn and infancy. But for this video, we are going to do early childhood, so younger than 5 years old. We want to be aware of the facts that we know about children younger than 5. So they're egocentric. They see things from their point of view, kind of like it revolves around them. You can't use like other children for examples. They won't really understand that. They might not be the most cooperative, so you can offer like treats if the parent allows, like candy or snacks or popsicles, ice cream, stuff like that, to try to become like more friendly so they're not as afraid. Yes, so we're also going to want to communicate with the child, because they're wanting to know like more things around them, and if they're egocentric and we're doing an assessment on them, they're going to want to be like, well, what the heck is going on? So explain everything in terms that they can understand, and just be cognizant of that. So alright, we will just begin our exam real quick. Hello, my name is Coden, and I am the nurse working tonight, and I'll be taking care of you. Are you mom? And they might say, yes, I'm mom. Or are you the caregiver? Or what relationship? You find that out. Also, if kids have like toys and stuff, you can do your assessment like on their toys, so they can visualize like what's going to be happening to them, and kind of get a little bit of a better understanding of that situation. And they can also benefit from seeing the equipment that we're going to be using on them. So like the stethoscope, maybe an otoscope if you're looking in their ears, if you have one. Pen light, these are pretty cool. And stethoscopes are always cool, getting to hear your own heart and lungs and stuff. So yeah, alrighty. So let's just jump right in. Okay, so this is mom. Hi there, my name is Coden, and I'm gonna be the nurse today. So we just have to do what's called a head-to-toe assessment. So basically, we just make sure that there's nothing wrong with you. We just start from your head down to your toes, make sure that everything is normal with your head, neck, chest, heart, lungs, stomach, muscles, all that fun stuff, and all that fun stuff. Do you want to kind of get an idea of what it's going to be like? And if they have a little toy, you can be like, okay, do your assessment on their little toy. Awesome. Or their blood pressure on the little toy. You can let them listen to their own heart and lungs when it comes time for that, to help reduce their anxiety. Okay, so we're gonna officially begin the head to toe. So alright, little Billy, now that you've seen all the equipment and everything, you think you're ready for your head to toe assessment? Yes, he's ready. Okay, so obviously when we walk in the room, we do our hand hygiene and put on our gloves and all that. So we're gonna assume I have those on. Alright, little Billy, just gonna give you a little head massage, just to make sure that there's no lumps or bumps or anything wrong with your head. And then while you're palpating, you can assess the appearance of the hair, the scalp. You can visualize if there's any dry skin, dry, cracked hair, cracked skin too, or brittle hair, I should say, or if it's properly hydrated or moisturized. And yeah, you just know what you find. So for this assessment, little Billy has a wonderful scalp. His hair is looking thick and lustrous, and there's no abnormal findings on his scalp. regarding his skin or anything like that. So good job, Billy. You're doing good there. Okay, so next we're going to use this little pen light, or in this case it's our otoscope. We're just going to take a look in your ears, okay? It shouldn't hurt at all. Let us know if you have any pain. Still doing good? Okay, you want to note that the tympanic membrane is intact, the appearance of it, maybe the color. If there's any injuries in the ear that you can visualize, or even on the outside, swelling, drainage, redness, bleeding, stuff like that. So, all right, Billy, we just checked your ears. Now we're gonna check your eyes, okay? I could have explained that a little better. I'm just gonna shine this light in your eyes, and we're just gonna make sure that your eyes are reacting or moving to light like they should. Sure. Okay. So, pupils are equally reactive and, oh my gosh, I just forgot what Perla is. Perla, and accommodating to light. So, check the eyes. While we're looking at the eyes, we can kind of assess some of the facial muscles. So, like, have them lift their eyebrows up, squeeze their eyes closed, open their mouth, stick their tongue out, shrug their shoulders. Hey, Billy, we're just gonna check your eyes out real quick, okay? So, without moving your head, can you follow my fingers for me? Just follow my fingers with your eyes. Okay, so oh yeah, also the 4 quadrants, and you can wiggle in each quadrant to make sure they have all vision in all 4 of the quadrants. Assess their nose, look in their nose and on the outside of it. Note if there's any nasal discharge, color, consistency, stuff like that. Congestion. And as always, as we're going down, we want to assess the neck, feel the pulses, preferably not at the same time, one at a time. Pulses, check for your lymph nodes, any unusual bumps or lumps in the neck. Same in the arms. All right, little Billy, can you lift your arms up for me? Good. Can you hold them out in front of you for 10 seconds? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Same for your legs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. All right. Can you push on my hands? Can you push this way? Good. How about your feet? Can you push down? Can you push up? Good. Can you move your legs all around for me? Good. Full range of motion on all extremities. And then still pulses again. Brachial, radial, pedal, popliteal. You might have to assess the GI and GU. So if you're assessing their GU, you would, ask some questions like, are you maybe open-ended, like, I can't think of one right now, but maybe open-ended questions that'll give him more opportunity to speak for himself and explain his experience and what he's dealing with. If he's having any problems with GI or GU, like if he's having any burning, like you can ask him, does it hurt when you go pee or stuff like that? Or do you have trouble pushing your poop out, stuff like that. Just simple language that they can understand. And All right, little Billy. Listen to your heart. Lungs. Listen on the back. 1, 2, 3, 4. All right. Heart sounds good. S1, S2 present. No gallops, clicks, or murmurs are noted. Regular rate, rhythm, strength. For the pulses too, note the strength and if they're thready, normal, bounding, what have you. And you also want to assess their spine. So you'll have them stand up and kind of bend over, and you will visualize the spine and make sure that it's straight, or note if it's curved, or palpate also if there's any unusual masses or things that need to be reported. And palpate the abdomen. Document the lung sounds. Lungs were clear bilaterally. Respirations unlabored, equal bilaterally. Chest rise symmetrical. When you palpate the abdomen, have them let you know if it hurts at all, because it shouldn't. If you feel any masses or stuff like that. So we would be doing that. Oh man, that's all I can think of right now. So I'm gonna go ahead and end the video.